Welcome. I'm Deborah Charoux, founder of Practitioner Development UK. We provide quality professional development courses for nurses and allied health professionals. The video clip you are about to see is a sample of the sort of training we offer on our musculoskeletal and minor injury programs. This is one of the many courses that we provide. For further information, go to our website, www.pduk.net. Thank you.
We're now going to examine the ankle, and ideally a patient should be on a couch or a bed or sitting on a chair with their leg resting across your own leg. You will have observed the patient coming into the department or into the examination room to see how they're walking, if they're limping or if they're walking on tiptoes or whatever position they're adapting to be most comfortable for them to walk. We're going to start again by looking, and the first thing we're going to look for are there any swelling around the ankle, any bruising, any redness there. And the first thing we're going to do on palpation is just feel the pedal pulse. So having felt that, I'm going to ask the patient to go through a range of passive movements, 4 movements of the ankle. I'm going to ask you to bring your foot towards you. This is dorsiflexion. I'm going to ask you to point your foot away. This is plantarflexion. I'm now going to ask you to bring your foot back to a neutral position and swing the sole of your foot away from me, which is inversion, and then swing the sole of your foot towards me, which is eversion. If the patient is unable to do this, you can assist them by doing passive movement and by getting them to completely relax the leg, and you do the movements for them. You may find that actually flexing the knee makes it a little bit more comfortable for them on some of these movements. Passive movements will get you a slightly greater range. Once you've gone through the movements, we then need to have a feel around the joints of the actual ankle. So we start, because we're going to use the Ottawa ankle rules to help us decide whether the patient needs an x-ray or not, we're going to start by looking at those specific areas indicated in the Ottawa ankle rules. And we have a feel around the posterior 6 centimetres of the medial malleolus. From there, we're going to come forward onto the navicular, which is this sort of bony prominence here. We come along to the metatarsal heads, just have a little feel around here, see if any of those are uncomfortable. And then on the outside of the ankle, we're going to move to the base of the 5th metatarsal, which is here. If you have tenderness at any of those 4 points, it either indicates an ankle x-ray is needed or a foot x-ray is needed. If you've decided there is no bony tenderness, yet the patient is still in pain, we need to look at the ligamental structures around the ankle. On the lateral side of the ankle, we have a T-shaped configuration. You have the anterior talar fibular ligament coming forwards, posterior talar fibular ligament going backwards, and the calcaneofibular ligament coming downwards. In order to palpate those, centre yourself on the lateral malleolus and come about 1 thumb width across, downwards and backwards. If you elicit tenderness there, it is a ligamental injury. For the medial side of the ankle, coming off of the medial malleolus, we have a very broad ligament called the deltoid ligament, and it comes across in a sort of triangular configuration. So we centre ourselves on the medial malleolus and then come down about a thumb width again and have a little feel there. If it's tender there, that's the medial malleolus ligament, the deltoid ligament. Again, a ligamentous injury rather than a bony injury.